the extra medical curriculum. We are continuing to look at the relationship between the Institute of Aesthetic Medicine and an allegation of criminal assault. I could not resist putting this slide in. A wonderful infographic appeared today in the South China Morning Post. Compliments to Lau Ka-kun. I am including this for educational purposes on a fair use basis pending permission from the publisher. Deng Xiaoping was an incredible person, and there was one quote attributed to him in this infographic which I thought was very pertinent to this evolving educational series. Seek truth from facts. A presentation to the Hong Kong Medical Association. This is about a postgraduate diploma course in aesthetic medicine. There's the presentation on the 5th of June, and this announcement appeared in the Hong Kong Medical Association newsletter on the 22nd of June, a Friday. We saw Professor Lai's shocked response, and there's been a weekend before we have a letter which we have now discovered was sent on the 25th of June from Dr. David Wong, representing the Hong Kong Society of Plastic, Reconstructive and Aesthetic Surgeons. Of note, this was sent without notifying the membership or consulting the membership. The Plastic Surgery Board did send an email to survey the opinions of the members, and I responded to that on Wednesday the 27th of June in the evening. With regard to the suggestion in the email from the Plastic Surgery Board that a letter had already been submitted by the Society, I had said that I was sure that couldn't be the case. I was sure that Dr. David Wong would have consulted with the membership because by acting without that moral authority, there was the possibility of bringing the Society into disrepute, and that was particularly with regard to the poor image of the Society that resulted from the Council abusing their position of trust and representationship of the membership. So we are developing our timeline, and we have the alleged assault, the letter of complaint, the letter written by Dr. Wong on behalf of the Society, and that was on the Monday the 25th, and on Wednesday the 27th my email, which must have caused perhaps a sleepless night for Dr. David Wong, who then had to decide what to do about the comments I'd made. Now, he sent his false allegation on the 30th of June, possibly with the expectation that I'd be hauled off to the police station on the Monday. But nothing happened, and it was a life as usual on the Monday and the Tuesday and the Wednesday and the Thursday, which is when we have our outpatient clinic. And I remember distinctly on that Thursday stopping David Wong in the corridor to ask him informally if there had been any conclusion to the discussions within the Society about how to respond to the Hong Kong Medical Association newsletter. Well, Dr. David Wong must have appreciated by then that he was entering a deep shit situation and sent this email at 5:30 on that same day, the 5th of July 2012. There were many recipients to his email, including 12 people who were not members of the Society, and these were all HA staff, and they included all of my trainees. This is what he said in his covering email. Many of you might have had some discussions on the proposed Institute of Aesthetic Medicine of the Hong Kong Medical Association. Take note that there has never been such a proposal. Indeed, he says, many have talked to various members of the council on this issue, In response, the council has already met the Hong Kong Medical Association representative on the 22nd of June. So they were acting very quickly because public notice of the meeting was only given on the 22nd of June. Then he says the council has, according to what it was informed, written to the Hong Kong Medical Association to express its position on the proposal on the 25th of June. So he's saying the council has written, and he is adding this, what it was informed. This is the way in which these dishonest and devious doctors act. He's trying to now shift the blame for his rather premature letter. He's trying to shift the blame onto the Hong Kong Medical Association representative. So let me just repeat again. The proposal was a postgraduate diploma course in aesthetic medicine, and I have absolutely no problem with the way it was announced. Yes, I was upset by the letter he sent. It wasn't professional, it wasn't appropriate, and I made a complaint to the Medical Council last year and received on the 28th of March this year quite an extraordinary response as far as I was concerned. The PIC had reviewed the complaint and decided there was nothing to support an act of professional misconduct, and I was told that the Medical Council's actions were concluded. However, the decision does not preclude you from pursuing other remedies you may wish to take, and this is my remedy. So, Miss Au, I did suggest that the chairman and the deputy chairman of the PIC recuse themselves from judgment on this issue. Dr. Choi Kin has demonstrated in a rather unwise Facebook posting that he is susceptible to rumour, and that gives a potential for bias to occur, particularly when the whole basis of the complaint is that the letter is defamatory, malicious, and promoting false rumours. Now, with regard to Fok Tai Fai, I have great respect for him, but he is a conservative, middle-aged medical person, and he has expressed quite negative comments to me about the whole aesthetic and cosmetic industry. And as such, I think he does not have the objectivity in this issue to make a fair and balanced judgment. And let us face it, this was a judgment, and I want to explain why they were wrong. Before we look at that offensive and pretentious letter again, let me first give you some background. So, and I'm addressing this to Ms. Charmaine now, look at your letter heading and what are the three core functions of the Medical Council of Hong Kong? Ensuring justice, maintaining professionalism, protecting the public. This is the preliminary investigation committee, chairman and deputy chairman listed there. This was a rather unfortunate Facebook posting that was in relation to the discussions about the treatment of Ms. Ixu Ling, which I felt was not appropriate, and had made some comments. And my response to Dr. Choi Kin, greetings, a political comment that would be expected from you, one that reflects an economy when reflecting the truth. Let me state without any reservation that there are many, many caring, compassionate, and highly skilled and excellent doctors in Hong Kong. And I say that as a colleague, as a teacher of many wonderful medical students, as a patient, and as a lifelong observer of humanity. But yes, I do have concerns about some, and I'm glad that you've recognized that. I'm no longer a registered medical practitioner in Hong Kong. That saddens me greatly. It's due to the protective policies of the Medical Council, and I am stating that those protective policies have nothing to do with ensuring justice, maintaining professionalism, or protecting the public. And as a member of the public, I'm now looking forward to working with the medical profession in Hong Kong to examine some of the problems the profession face and to look for some solutions that are based on the fundamental principles of medical practice: autonomy, beneficence, distributive justice, and non-malfeasance. Well, in the letter that I received from the Medical Council, they did give a preamble about the responsibilities and say that any professional behaviour or practice falling short of the standards expected of a doctor may be regarded as professional misconduct. And they say it is for the Medical Council to judge whether a doctor has fallen short of the standards expected amongst doctors in the given circumstances. And they were given the circumstances, and they were given the letter, and this is the conclusion that could possibly be taken from what they are saying. The Medical Council of Hong Kong confirms it expects doctors to lie, defame, indulge in malicious rumour spreading when appropriate. Now, please don't quote me out of context. I'm not being serious, but this is a major problem with regard to the perception of the regulatory rigour of the Medical Council. So let's look at this letter. There it is, 25th of June, from the President of the Hong Kong Society of Plastic, Reconstructive and Aesthetic Surgeons. I have to accept some responsibility for this name for the society. It was the Hong Kong Society of Plastic and Reconstructive Surgeons. In the middle of the first decade of this century, there was a change in the name of the British Association of Plastic Surgeons, which was the mainstream plastic surgical professional association when I was training in the UK. There was a change from BAPS to BAPRAS, the British Association of Plastic, Reconstructive and Aesthetic Surgeons. And this change, rather ironically, was suggested by a professional marketing company that was engaged by BAPS to try and raise their professional profile within the NHS. I went along with it at the time, but I do think about these things, and I now think that it's rather much of a nonsense, because any plastic surgeon worth their beans should be performing aesthetic procedures. That means that anything you do in plastic surgery should look good, be balanced in proportion. And this is nothing to do with cosmetic surgery. Let's go back to the letter. There it is, 25th of June, 5 days before this doctor alleges I criminally assaulted him. He's had a weekend to draft and redraft this letter, and I'm sure he referred to his textbooks to see how he could make it look official and important, and he has taken the rather lawyerly approach to referring to the society, the association, and so then he subsequently then says the society, in representing the views of plastic surgeons in Hong Kong, feels it has an obligation to suggest the following. Now, the society does not represent the views of plastic surgeons in Hong Kong. I'm a plastic surgeon, or I was then a plastic surgeon in Hong Kong, and they certainly didn't represent my views, and they represent a proportion of plastic surgeons' views, but not all. The proposed scheme aims at certifying doctors after short courses to the specialty. Well, this is stating as fact something that has never been proposed. That is a deception. That is not appropriate. There has never been any proposal to set up an institute of aesthetic medicine or to conduct a certificate course in aesthetic medicine. He is deliberately distorting the truth. And the letter is obviously written by a person who has no idea what aesthetic medicine is. I introduced that in the first of the videos looking at this association between the Institute of Aesthetic Medicine and an allegation of criminal assault. You can refer back to it in that video. But aesthetic medicine is a branch of medicine which is looking at the pathophysiology of aging and adheres to scientifically based and validated procedures. There is no such specialty in Hong Kong at this time. He then mentions about the course and certification will foster a false sense of security, blah, blah, blah. Well, there never was any proposal to have a certification after a short course. It was a postgraduate diploma after a year at least of part-time study. And when he says that it will be of detriment to our members, I wonder whether he's referring to the society or the association. But what detriment, what members? And does it all come down to money? Is that the bottom line that we're really looking at here? He proceeds by saying we're deeply worried that a certificate course in aesthetic medicine might incite inadequately trained doctors to indulge in the aesthetic business for monetary gain at the expense of proper standards. This is sophistry. And I think it is important for the people of Hong Kong to know that there is no organized training program for specialist doctors in Hong Kong to undertake these aesthetic procedures, and everybody in Hong Kong learns them from going to short courses which are usually industry sponsored. It was this very problem that we wanted to address by a postgraduate diploma. So this is complete misrepresentation, and he's saying this should not be encouraged nor should be steered by our respectable association. To learn new skills from the mere attendance of short courses for doctors, not in the specialty, and we're not sure what specialty is referring to now, would be tantamount to providing a sloppy shortcut for properly endorsed medical training. This is very disingenuous because at the moment, attending short courses is how people learn some of these aesthetic procedures in Hong Kong. And when he says that this would have the effect of making proper specialty training meaningless, I think that that has already been well achieved by Dr. David Wong Sao Yan, by the apparent conspiracy to defraud the public, which has been submitted to the ICAC and will be forwarded to the Consumer Council, because the information that appears on his society website is misleading and contravenes the Trade Descriptions Act. So the Consumer Council will be, or the Consumer Protection Bureau will be hearing about that. So let's continue. How does this letter end? To this end, the Society respectfully urges the Association to consider seriously to withdraw from, essentially, further discussions with Professor Bird. That's what he's saying. And he is saying that on behalf of the Council of the Society, and he is signing it as the President of the Society, but also as a consultant plastic surgeon, Division of Plastic Reconstructive and Aesthetic Surgery, Department of Surgery, the Chinese University of Hong Kong. To be pernicious, he is not a consultant plastic surgeon of that division. He is a consultant plastic surgeon of the Division of Plastic and Reconstructive Surgery of the Department of Surgery of the Prince of Wales Hospital. He is an honorary something of the Division of Plastic Reconstructive and Aesthetic Surgery of the Department of Surgery of the Chinese University of Hong Kong. But whatever the case, he's sending his letter to people who are in the society, but also those who are not in the society, who are HA staff, and he included my trainees. To follow, we will look at the conclusion of the email I was writing to the solicitor on the 10th of July 2012, which was copied to a representative of the Medical Protection Society, and then we shall see my official complaint to the hospital authority about this letter sent by a senior HA staff member.